So I'm going to gather my supplies. I'm going to have my extension tubing, lock device, and my normal saline syringe. Before that, I washed my hands, and so I'm going to scrub the hub of this, and then attach that to the normal saline, and then prime it. Okay, so once that's done, I'm going to go into the room and I would introduce myself. Hi, my name is Natalie. I'm a nursing student from Cedarville University. Today I'm going to be inserting a catheter, or not a catheter, an IV into your arm. Do you have any questions before we begin? Okay. Can you tell me your name and date of birth? Okay. So before I begin, I'm going to tape the tegaderm on my tape. My gloves on. Alright, I'm going to pick a spot here and put the tourniquet on first. I can only leave this on for 2 minutes. I have to remove it. I'm going to pick a spot here and clean it with a chlorhexidine and let it dry. And while it's drying, I'm going to release that. Once it's dried, I will put the tourniquet back on. I'm going to put this in at a 10 to 30 degree angle, bevel up. Once that's in, I'm going to reduce the angle and push it 1/4 of an inch. And then push the catheter in only. Once that's done, I'm going to put a 2x2 gauze pad underneath and release the tourniquet. After that's done, I'm going to push down with one of my fingers on the vein and then pull the needle out. There's flashback, so I'm going to take this off, attach the extension tubing. Once that's done, I would flush with normal saline. Okay. After that, I'm going to put the tegaderm on. Okay, and I would tape it, and then I would initial the tegaderm with my initials, date and time. And I would also get my solution ready, and I would set the drip rate. Once that's done, I would remove my gloves, clean up everything, and then wash my hands. And I would also document that I have the date and time. I would document the date and time and the site, the size of the catheter, the number of attempts, and the type of solution and the rate as well. And next, I'm going to discontinue the IV. So I'm going to get new gloves here.
Unless you'd rather me go in there and watch you.
So again, I would come in and wash my hands and introduce myself to the patient. I would ask them what their name and date of birth is, and then I'd be ready to discontinue the IV. So I'm going to gather my supplies, put my gloves on here. So I'd have a gauze pad, and then I'd also have a Band-Aid as well. So I'm going to be careful and remove the tape. And then I'd remove the catheter slowly and making sure I don't hurt anything. So the catheter is out, and I would push on the spot with a gauze pad for 2 to 3 minutes until the bleeding would stop, and then I would put a Band-Aid on it after that. I would throw away my supplies, clean up, and then remove my gloves and wash my hands, and then I would document what I did.